All right, so if you guys wouldn't mind just putting your name in the chat for me as more people are coming on here. We potentially may send some just feedback emails out. So if you wouldn't mind doing that, that would be great. And we'll go ahead and get started. My name is Megan Conway, and I am a community program coordinator at Prevent Blindness Wisconsin. Today, we're just going to be discussing AMD, which is age-related macular degeneration and low vision awareness. Last year, we started to do these monthly webinars with monthly observances, so each month is different. Again, this month is AMD and low vision awareness. We'll be sending out fairly soon next month, which is workplace wellness as well. So feel free to join on into that as well. And let's see if I can jump screen here. Okay, so a little bit about Prevent Blindness Wisconsin. I'm sure you guys probably know a little bit about us, but just a general overview. We are a nonprofit organization. We're located in downtown Milwaukee, but we do service the entire state of Wisconsin through all of our preventative vision health services. We do a lot of vision screening activities, public health education, and our vision at PBW is for each Wisconsin resident to have healthy vision at every stage of life. So we have a lot of great partnerships in the state. We are a small staff, a full-time staff of 9. So we rely heavily on our partnerships to service the entire state. We do everything from cradle to grave. So we do, children's vision health all the way through the aging eye. And through that vision health and screenings and stuff. So we have partnerships with Wisconsin health departments, shelters, Department of Public Instruction. We work with a lot of school nurses, Head Starts, child care centers, free and reduced clinics, and we have a great connection with the Wisconsin Lions Foundation as well. And so we're able to support all of those partners through the state with their vision screenings. A little bit about what we have done this past fiscal year. Even with COVID, we still were able to get out and still keep servicing the entire state. And so we served over 14,000 Wisconsin residents with all of our preventative vision health services. We were able to average a follow-up rate of 46%, and that was moving referred clients on to that further needed vision care. Those that were screened that needed to have that extra care into the eye doctor, we were able to refer those clients. We did conduct and offer over 100 children and adult vision screening training courses statewide, and we were able to do those both virtually and a couple in person as well, and train and certify a lot of partners and volunteers as certified vision screeners. We also were able to reach over 400,000 Wisconsinites through those trainings, but also we have social media. We did some radio ads, a lot of presentations, and we have a monthly FYI newsletter as well. So really great numbers. We're pretty happy with the outcome, and hopefully in this next fiscal year, we're able to show even more growth. So today I'm just going to talk about AMD. What is age-related macular degeneration? There's a lot of moving parts involved with AMD. We want to know, we're going to discuss the different types and what those risk factors and common signs or symptoms are. Are there things that we notice? Is there any prevention for us? How do we detect it? What do doctors do to put that treatment plan in place? And then we'll also touch a little bit on low vision, living with low vision, how to continue and maintain those activities of daily life. So just a little bit of cool eye anatomy here. The eye is very fascinating. There are so many different moving parts of the human eye. When light enters our eye, it enters through this cornea here. It goes through the pupil, through our lens, and into that vitreous body, that jelly-like portion of our eye. And those light rays land back here on this yellow portion, which is the retina and the macula. We'll talk a lot about the macula with this age-related macular degeneration. And then those light rays, when they hit on the retina, that signal gets sent through our optic nerve. And that is the main channel of communication between our eyes and our brain. So what our eyes are seeing, they're sending that signal through the optic nerve to our brain, sending us that signal of what we're seeing. So what is AMD? What is age-related macular degeneration? This is a long-term eye disease. It affects the central vision in our eyes over time. The macula of the eye picks up the fine details of what we're seeing. And so, when we have that central field of vision affected, it's really hard to make out specific things that are in front of us. Now, AMD is the leading cause of vision loss in people 50 years or older, and it is a chronic disease. So like I said earlier, there are two different types of AMD. The first type we'll talk about is dry AMD. This is the most common type, and it does result in permanent vision loss over time. With dry AMD, that macula on the back of our eye does thin. With dry AMD, it will thin as we age, but we get a buildup of drusen, which is small protein deposits, and those develop underneath the macula of the eye, which gets in the way, causing that blurred vision that we're seeing. We're not able to pick out those fine details. We can't prevent this drusen from developing, and we can't really prevent dry AMD, but there are treatments put in place to kind of slow the progression. The other type that we have is called wet AMD. This is a less common, but a more serious form of age-related macular degeneration. This results in severe vision loss very quickly. Dry AMD can develop into wet AMD. It's more those later stages and more severe. So with wet AMD, there's a formation of abnormal blood vessels that are forming underneath the macula of our eye. And that's kind of causing the macula to bulge out from its regular position. Here we can see these are forming, pushing on that eye, causing that abnormal bulging from the eye. There are several different risk factors. Aging, family history can be a risk factor. If other people in your family have it. Race, gender, farsightedness, or hyperopia can be a risk factor as well. And smoking is a big risk factor. A lot of times we think of smoking as affecting, other certain body parts like our lungs, but smoking has a huge effect on our eyes as well. With this, and we'll talk a little bit about it later, those that smoke are 4 times more likely to develop age-related macular degeneration. The highest risk population that we typically see for age-related macular degeneration are Caucasian women 50 years or older. Those of European descent, we see that increase. Those with blue or green eyes are the highest population risk. What are common signs and symptoms? Typically, we will see blurred vision. This is a really great picture we have here too with macular degeneration. We have this big black spot in this central vision that we're not able to see. So we can't pick out those fine details. Things look very blurry. There can be waves or shadows through that vision that we see. It distorts the way we see things. People may have trouble discerning colors, especially picking out those dark colors from the light colors. There can be difficulty moving from bright light to low light, moving from a bright lit room into a low lit room. That can be a common sign and symptom if we have difficulty with that. But often there are no symptoms. So with that, we always recommend going in to receive that regular dilated eye exam because there are often no symptoms. And since we can't prevent this from, really developing that dry AMD, going into the eye doctor so they can dilate that pupil, they can, open that light to come in and see that portion of the retina more clearly. That is always going to be extremely important because there often are no symptoms. So that is a huge thing that we at PBW recommend. It's like our driving force is always, go in to receive your regular dilated eye exam because it's the best form of prevention. AMD detection. So when people are diagnosed with AMD, they will be given what we call the Amsler grid. And this is used to monitor the progression of age-related macular degeneration once someone is diagnosed. They can take this grid home with them, place it on the fridge or wherever they will see it often. And then they can monitor, what is changing in their vision from day to day. So here we can see this is what the Amsler grid looks like to you and me that don't have AMD. Someone that has AMD that is looking at that Amsler grid, we see this kind of wavy distortion form like we talked about with some of those common signs and symptoms. So that's a great way to kind of monitor the progression. For some treatment options, treatments for dry AMD and wet AMD are different depending on which one you have. But those treatments come in the form of there's medicines, there's surgery. Doctors will use lasers to try and hit the tissue on the back of the eye. Again, it's important to remember any damage done to our eyes can't be undone. So we always want to get that early prevention piece in of going to the eye doctor and get those eye exams yearly to prevent any further damage. When we have dry AMD, a treatment option that an eye doctor may put in place is the AREDS 2 formula. And this is a combination of vitamins that try to slow the progression of AMD. It's a cocktail of vitamin C, vitamin E, copper, lutein, zinc, and zeaxanthin. And that will, again, slow the progression. We can't completely stop it from happening, but we can slow it. Another great suggestion, and we'll talk about it a little bit more in the next couple of slides here, is to eat for your eyes. Again, healthy diet is more than just eating, for a whole slew of other things, but also to eat for your eyes. It's really great to get those vitamins that we see here are in those foods. For wet AMD, doctors will use anti-VEGF drugs, which is anti-vascular endothelial growth factor. And these are injected into the eye, and those drugs will help to stop the development of those new blood vessels that form in the eye that are causing that macula to bulge out. Another option for wet AMD is laser surgery. There are two different kinds of laser surgery, but they help to either destroy those blood vessels that are there or destroy the tissue in the eye to stop blood vessels, new blood vessels from forming altogether. And so they will use that laser, shine on the new blood cells formed in the back of the eye to break down those that are already there, or again, seal up any blood vessels and hopefully prevent new ones from forming. When we have low vision, we have a reduction in visual acuity, what we're able to see. And we're not able to treat that with a pair of prescription lenses or a simple surgery. So typically, low vision is a symptom that will occur due to other existing vision concerns, such as AMD. When we have that central field of vision that is distorted, that's going to cause and lead to low vision. Glaucoma or trauma to the eye or head can also cause that. We'll see trauma to the head can cause changes in pupil sizes or cataracts, etc., and that can lead to low vision. Common signs and symptoms of low vision. Sometimes we'll have difficulty recognizing faces. Again, with AMD, that central vision, that picture we saw a few slides ago, we have that black spot in the central vision. So if we're walking up to somebody, that central portion that we're looking at of someone's face is going to be what we can't see, but we'll be able to see everything around their face. So difficulty recognizing faces is a big one with that loss of central vision. Sometimes common signs and symptoms can be blind spots of just maybe certain areas around the eye that we're not able to see things. And seeing colors, matching clothes can be difficult too, discerning those light colors from those dark colors as well. But there's a lot of adjustments and adaptation that we can make to everyday life. This picture right here is what I believe is called a bump dot. And this is somebody that has low vision that's able to put those bump dots maybe on like the 350 degrees, which is pretty typical when people are cooking. So you know when to turn the dial to. Some people will put them on the microwave, since those microwave buttons are so flat. You know, if you put it on like the number 5 button, then you can kind of place where the number 5 is, and you'll know the other numbers that are located around that 5. Many things like that. There's a lot of different adaptation pieces, tools that can be used. Other things such as magnifying glasses, screens and stands can always help. There's telescopic lenses, high intensity reading lamps, so we can really get that light in to see what's in front of us. Newspapers, magazines, and books. It seems like every time you pick up a newspaper, that fine print gets smaller every time. So getting large print newspapers or magazines and books is a really great, easy fix for us to try and increase that print and be able to, you know, see things more clearly without having to get all this different adaptive tools. There are also closed circuit TVs that magnify a printed page on a screen, and these are pretty cool. It'll be like a screen, you can put a piece of paper underneath, and that will project the image onto the television. You know, depending what size TV you have, it can project that in a really big image, and those are pretty cool. And also computers and tablets, you know, in this day and age with technology on our phones, things look really small, but we're able to kind of zoom in to make that image appear bigger, which is also a very huge help for people with low vision, but also just for people that aren't able to see those fine details in general is really great. So we did talk a little bit about smoking before, but it is a great piece of prevention for AMD. We always say, you know, don't smoke because it affects your eyes. If you do smoke, we definitely would recommend quitting because, again, as I said before, those that smoke are 4 times more likely to develop AMD than those that don't. And that also involves secondhand smoke. So you know, we see some people can develop lung cancer from, even if they don't smoke, being involved in secondhand smoke. So again, it goes a lot more to just the normal things we think of. Things like smoking do affect our eyes greatly as well. And then we talked about eating for our eyes, but this is that great piece of prevention as well, to try and get those food sources in to support your vision health. You know, we talked about that zeaxanthin and lutein. Those are really great with the dark leafy greens, things like kale, spinach, collard greens, or Swiss chard. Those things have those vitamins in them naturally, so it's great to get them through a supplement, but if we can eat them through if we can get them through the food we eat, that's a huge bonus. Sweet potatoes, citrus fruits like oranges, grapefruits, and lemons. To get those omega-3 fatty acids, you know, sometimes we'll think of taking a simple fish oil supplement, but we can also get those omega-3 fatty acids through cold water fish like salmon, tuna, sardines, and trout. And then, of course, you know, exercise is a great prevention of not only AMD, but just healthy living as well. We do offer some financial assistance and resources, but for AMD specifically, Medicare covers some diagnostic testing and treatments for macular degeneration. And with that wet AMD, sometimes they'll cover that injectable drug treatment that we talked about. But it is always best, you know, to check with your doctor and see if the treatment plan that's put in place for you is covered through your HMO or, you know, through your vision care. Some other resources that we have through Prevent Blindness would be the Guide Me. And there's a Guide Me for age-related macular degeneration. And this is a form you can kind of fill out. It's not only for people that have been recently diagnosed and going through living with AMD themselves, but for family members and caregivers too. You get to fill it out. It kind of tells you a little bit about a guide of kind of next steps and that kind of stuff. And there's also a guide for living well with low vision. And that's a great online resource. Educates those with loss of vision on how to maintain their independence and quality of life, kind of like using those bump dots or that adaptive resources that we can use as well. So you can always visit our website. We have a lot of stuff for adult vision health. We have great kind of sheets for how to make an eye doctor appointment. And that kind of pieces out step by step of, what is your vision insurance? Do you have Badger Care, Medicaid, Medicare? How do you access that specific care? How do you make that eye doctor appointment? We have eye care provider guides, which are broken down by county. So you can see where can I go to get an eye exam? What eye doctors are even out there? We have great health literate fact sheets on common vision concerns for adults. A lot of times when we go to the eye doctor, those posters and stuff that we see in the office, they are at a very high reading level. It's either, 8th grade, but sometimes even above at 11th grade reading level. And the typical reading level that we see is about a 3rd to a 5th grade reading level. So we're able to provide those health literate fact sheets that are easy to read, easy to understand. And then, of course, we always have all of our public education videos on there, which are really great, kind of spread that vision health education. And we have a lot of volunteer opportunities and much more. So if you want to become a volunteer, we offer those certified vision courses as well. And I'm always going to put the plug in for our social media here. We are on Facebook, Instagram, Twitter, and LinkedIn. We love to post pictures of people screening, see how much fun they're having. It's really great to be able to see people getting out in their community and interacting with kids and adults. So we do have a couple of minutes left. If anyone has any questions, you're welcome to, go ahead and ask those. I will stay on. Otherwise, you can always email me as well, and I put my information up for you here as well. And thank you all for joining. All right, so I see a question here. I'm just going to stop recording.